Brief 2, matchmaking, a fresh perspective on balancing supply and demand. Quick reminder, this and all briefs and all artifacts from the ThinkSummit 2025 are being openly shared under this Creative Commons license. You'll recall the point of the briefs is to reframe the access to care challenge. And here we're using a consumer tech lens because it's different than a healthcare lens, and it enables us to reframe patients as consumers of healthcare services. We live in a world saturated by recommendation engines, so I know you know all about this, because if you have any digital services, you're getting a feed, and that's based on a recommendation engine. But it's useful to go back and rewind how we got here and where we're going and how this applies to health systems. So let's go back to the beginning, matchmaking 101. You know, back in the day, people just made decisions. How many trains do we need? How many schools do we need? How many hospitals do we need? They just decided. No data. However, they did have experience. And the more experience you had, the better you could make decisions. And the reason was you got better and better at understanding the context, what was actually going on, and predicting what was going to come. You had that because you had more experience. Fast forward to matchmaking 2.0, where we began to enter the computer era, converting old paper records into data. We structured the data so that it could be searched and queried if you wanted to make a decision. That was really helpful, particularly for things like matching supply and demand. How many trucks, how many planes, how many doctors do we need to train? The reason this was helpful was that looking backwards on that data was kind of like adding years of experience. You could get a view into historical data even though you didn't live through it. Early systems, though, were completely siloed, so it became necessary to begin to find ways to look across more than one system. Enter the era of business intelligence. And that was a big leap forward, again, really for the same reason. You got exposed to that much more history without having to live that many more years. How many hospitals to build, how many doctors and nurses to train, what equipment do we buy? Healthcare was a huge early adopter of this, and we all benefited. Matchmaking 3.0, what I'll call our current era, the AI era. Some people would say it started with the launch of ChatGPT, but in fact, it goes back to the early aughts, more than 20 years now. And it started not by healthcare companies, but by consumer-facing companies who are collecting all sorts of unstructured data off mobile devices and web browsers. Companies like Facebook and Amazon and Google, they were pioneers in the sense that they were getting these streams of contextual data and they thought it could be valuable, but it was unstructured, so business intelligence tools weren't helpful to them, and they didn't have the sort of organizational historic data that everybody was used to working with. And what they wanted to do is figure out a way to use these streams of contextual data, real-time, in-the-moment data, to predict events. They hired some of the best computer scientists in the world to try to figure it out. They were using things like location and speed and direction and topic interests and social connections and so on to try to figure out how can we predict what's coming and monetize that. They brute forced it at the beginning, but over time, they figured out technological ways to do this. They spent billions collectively to get the know-how and technology needed to turn these streams of unstructured data into future-facing predictions. And that wasn't really an add-on to a traditional business intelligence suite. It was a brand new stack. Turned out to be a pretty good investment. Collectively, these companies have unlocked trillions in value. But the interesting thing for our discussion here is they are literally built on prediction engines. That's what unlocked the value for the tech giants. Matchmaking powers the web as we know it today because matchmaking using predictive recommendation engines is the foundation of the consumer internet. Targeted digital ads, content creation, personalization, matching capacity with demand in marketplaces, it's all because of these prediction engines. But matchmaking 3.0 requires context. I'm going to use an example we all know, and then I'll switch to a healthcare example. But everybody knows Uber, and really they're a tech giant powered by prediction. At their core, they're a digital marketplace. Their main job is to have a person with a transportation job, match them to someone who will solve the transportation job, drivers who would take someone where they wanted to go. But the thing is, without the ability to make predictions based on contextual data streams, Uber wouldn't exist because they actually need visibility into thousands and thousands and thousands of people. Where are they? Where are they moving? Thousands and thousands of drivers. Where are they? Where are they moving? What's the traffic flow? Who's available? Who's not available? They want real-time weather. They want real-time traffic. They want real-time information into when does the big event get out. They need tons of contextual streams of data that's not historical, it's real-time. Okay, but how does that relate to healthcare? Well, as we've seen, health systems can also be viewed as a marketplace. Their job is to match people with a health job to a solution to that health job, supply and demand. It's easy to think of if it's a simple request, right? I have this problem, I need to see a doctor for that. Okay, great, that's simple, like find a hole in a schedule. But when you start wanting to predict demand and do things to match capacity to the predicted demand and maybe one day even reduce demand, that's a prediction engine. Okay, let's think about that for a second. A little mental experiment. Let's use trusted health wellness companions. It's an AI thing. It's not here yet, but you know it's coming. In fact, it's coming faster than you might think. A number of tier one health organizations are already investing very heavily in this. I'm not talking about a portal and you could get a PDF for this condition you were just diagnosed with. I'm talking about a generative AI conversational interface based on trusted information so that the answers are trustworthy and so that the underlying engine can begin to understand what conditions is someone going through, what kind of behaviors are they demonstrating, and therefore begin to predict demand and hopefully reduce the need for demand. Some of the questions that are going to hit these conversational companions are going to fall squarely in the realm of treatment, right? Like once you've been diagnosed with something, you've got all kinds of questions. You can't get in to see a doctor to ask them, but an AI health companion based on trustworthy information could provide really valuable answers. Cool, that's going to be really helpful. But most of the questions are going to fall outside of that because people don't want to need treatment. They have all sorts of things every day that they traditionally go to Google for. We all know how that turns out. But a trusted companion could be a genuinely powerful resource. And that would be great because the only way to reduce the need for treatment is to go end to end and to give people trustworthy information and answers to try to shape their behavior in ways that prevent the need for treatment. But this represents a challenge because the historical healthcare records that health systems have are not enough to power trusted information and answers that go across the whole spectrum. And you can forget about genuine personalization without these streams of contextual data. Wait, that sounds like a nightmare from a privacy point of view, right? Well, let's look at that. Meet Bob. Bob's a regular guy. In other words, he really has no interest in healthcare at all, unless he's having a hard time. And today, he's having a hard time, specifically a little trouble breathing. He's not sure what's going on, but he's a bit concerned about it. So he calls up Sal. Sal is his AI healthcare companion. And he trusts Sal because Sal came from his healthcare provider. So he explains the situation to Sal and he asks Sal to try to make some sense out of this. Well, Sal starts to ask Bob some questions and Bob answers the questions. And the whole experience is very conversational and feels very natural to Bob and really personal because Sal has a full history of anything they've ever chatted about. So he's got full context. And he also has access to all of Bob's medical records, and Sal only uses trustworthy sources of information provided by Bob's healthcare provider, so he trusts it. Interestingly, though, Bob has also given Sal permission to check some things right on his phone, and that's incredibly helpful. As an example, like when this happened, what was his activity rate? What was his heart rate? What was going on with the weather and the pollution? From a more longitudinal way, what was happening with his resting heart rate and his longitudinal blood ox and blood pressure? Sal can pull in these contextual data streams, and it's very helpful to figure out what's going on. And quite quickly, Sal determined that this should get escalated. Bob should have a call with a clinician. Don't panic. Bob's fine. He got it looked at soon enough to avoid a potential emergency. But the point I wanted to make is that during all this, none of his personal data was ever risked because it was never shared. The data he had on his phone stayed on the phone. The data in the lab stayed in the lab. The data in omics stayed in omics. And the model that coordinated all this and then made sense out of it, that belonged to the healthcare system and lived inside a clinical grade environment. This was absolutely safe from a data privacy point of view. And it had to be because matchmaking 3.0 requires context to do prediction. And to get the context, it is federated. Contextual data streams bring in all sorts of sovereign compliance laws. And that's why virtually all consumer-facing prediction engines embrace a federated data approach. It's privacy first and globally compliant. Federated data and computation is used billions of times a day. Bob uses it, and so do you. You just don't know it. Well, does this work inside a health system? Well, you bet it does. NHS launched their system-wide federated data network for doing population-level research 2 years ago. So did Ontario. Federated data and computation is a well-established approach for population research. But this can go way further than population research. India's health tech stack takes federation to a massive scale. It's a mobile-first federated data platform aimed at creating a personal health record for 1.5 billion people. It's amazing because it's a philosophical shift away from a provider-centric view of who owns the data to a patient-owned health data ecosystem. It lets researchers work across national boundaries and stay compliant. It's being used to train AI models on distributed personal health records without ever doing any data exchange. But here's the rub. To unlock the predictive capabilities we need to reduce demand and improve access to care requires consumer-first end-to-end contextual data streams. We have to actually begin answering questions that extend beyond treatment and influencing behaviors and understanding what outcomes are happening. All of that requires federating out to the edge, which is why trusted AI health and wellness companions, they're going to be a massive unlock, but they require a different approach from a technology and privacy point of view. Conclusion? The technology for predictive matchmaking is both proven and accessible. Leveraging contextual data streams enables both demand prediction and demand reduction. And all of this is available to healthcare systems today. In my opinion, if a tech titan were given the task of solving the access to care challenge, the first thing they do is stand up an AI-powered matchmaking engine. Thank you. So in the actual event, at this time, we shift to having discussion. And I'm going to put to you the same thoughts I did to the group. What concepts that were covered in this brief resonate for you and why? And what gives you heartburn and why? And what's already going on in healthcare along these lines that's good or bad? And how can we leverage that in our systems to help reduce the gap between supply and demand? And what first principles stand out for you? And how do we leverage those? Here's one. Prediction demand requires contextual data streams. The only way you can predict how much demand there's going to be is using one of these prediction engines, and that requires a new stack and an end-to-end view. What other first principles do you see? I would encourage you to review the brief and have discussion with your colleagues and see if you can come up with any actionable insights. Solving access to care is a priority challenge for all Canadians. Thank you.